Hello everyone, Dr. David Kulla here with Synergy Wellness. I'm here with
Peter Black.
Peter. All right. So I'm here with Peter and I really wanted to do a video on this. If you're someone that has back pain and has gotten injections, you're going to want to listen to this. So I'm here doing a history with him. And he's a horseback rider. I grew up on a horse farm, by the way. So I know quite a bit about horseback riding and how rough it is on your back, especially if you get thrown off the horse. I assume he hasn't been thrown off a horse, but he's rode 8 hours. After that, he's had a year or two later just back pain on and off since then. So since 2016. A year later, he went to a spine specialist at Mount Sinai. We're not going to mention any names, but his initials are DP. Okay, so he walked in with back pain, no pain shooting down the legs, just lower back pain. And what he did first, right, was nerve blocks. 16 injections and nerve blocks. And then afterwards told him your muscles are really tight and I'm going to send you to PT. At Mount Sinai.
Correct.
Well, duh, of course his muscles are tight. He's got back pain. I mean, anybody with back pain has muscles that are tight. I'm sorry. But he did it backwards. Why would you give a person nerve blocks when they don't have nerve pain? And you're just, it's coming to light to you now. And maybe now it'll make sense to you. A nerve block is for someone that's got pain shooting down their legs, sciatica down one or both legs, unrelenting, nothing's working and helping. And even then, he probably still would have done the nerve blocks without sending you for conservative therapy. It's not the right approach, okay, to just go and do a nerve block and then send him to PT. What he should have done was sent him to PT first. And then if that didn't work in 6 to 8 weeks or wasn't helping him, then do the nerve block. So you had the nerve block done, and how long did it give you pain relief for?
About 2 days.
2 days.
Not even.
Yeah. And nerve blocks are just, I mean, if you look at the outcomes, they're dismal. They're dismal. I mean, I wonder if these surgeons even care or if they even look at the outcomes. I really do wonder. If they did, they probably wouldn't do half the procedures or probably 3/4 of the procedures that they do in their office. I guess they'd be out of business. But that was done backwards. So if you're suffering from back pain and a doctor is ready to shoot you up with an injection or give you a medication without sending you for conservative therapy, you should take a step back and be concerned. Something's off here. Okay, and when I mean conservative therapy, what I mean by that is physical therapy, chiropractic, acupuncture. I'm not going to get into what's better and what you should do for your back and what's worked better for your back. Everybody has their preference. I personally don't like needles put in me, so I don't like acupuncture. I don't relax. I can't relax when a needle is stuck in me. I just can't. Physical therapy and chiropractic, and there have been tons of studies done on what's better for back pain. I would say both are great for back pain, but if you're having pain shooting down your leg, numbness, tingling in the toes, sciatic nerve pain, you're definitely better off starting with chiropractic and then going on to physical therapy to strengthen your core, stretch, and rehab the soft tissue around the spine. That being said, I wanted to do a video on this, and I wanted to just explain to you guys, if you're suffering from back pain, think about it logically. Don't jump for that quick fix, and oftentimes it's not a quick fix. Always try conservative therapies first before, and even ibuprofen and ADVIL is considered conservative therapy before you would get a nerve block. Did he even recommend taking ADVIL or ibuprofen for a week or two?
At some point I was taking some of that. But
you were already, and it wasn't helping.
Once in a while it helps, but not all the time.
Okay.
So naproxen, depending on which one.
Yeah.
One of them would work, but down the road, first of all, you can't take it every day. And every
Yeah.
time I didn't take it, the pain would come back.
Yeah, and I'm not advocating, you take medication every day. That has side effects, and that doesn't get to the cause of the problem. Chiropractic, physical therapy, or hands-on therapies that do. So, lesson learned. We're going to end it there. If you have any questions or comments, or you feel like you've been medically mistreated, is that the right word? I mean, medically mistreated. Sometimes docs do things for the money. I don't know if he was billing your insurance, and that's not the reason to get into medicine. Anybody that gets into medicine to live a really good lifestyle, that's a danger. Unfortunately, every profession does that. It's not just exclusive to doctors, but this is a case of a nerve block done way too soon. Okay? Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.